If you're turning 65 soon, or you're already on Medicare and still confused about how it all works, you're not alone. Medicare is one of the most important benefits you'll ever receive, but it can also be one of the most confusing. In the next 10 minutes, I'm going to break it all down for you, in plain English. What Medicare is, what it covers, what it costs, and when you need to sign up. Let's get started. Medicare is a federal health insurance program run by the United States government. It was created in 1965, and today it covers more than 65 million Americans, primarily people who are 65 or older, but also younger people with certain disabilities or conditions like end-stage renal disease. Medicare is divided into 4 parts: Part A, Part B, Part C, and Part D. Each part covers different things. Let's go through each one. Part A is your hospital insurance. It covers inpatient hospital stays, skilled nursing facility care, hospice care, and some home health care. Here's the good news about Part A. Most people don't pay a monthly premium for it. If you or your spouse worked and paid Medicare taxes for at least 40 quarters, that's 10 years, you get Part A for free. However, Part A does have a deductible. In 2024, that deductible is $1,132 per benefit period. So while the premium may be free, there are still out-of-pocket costs if you're hospitalized. Part B is your medical insurance. It covers doctor visits, outpatient care, preventive services, and medically necessary services like lab tests and durable medical equipment. Unlike Part A, Part B has a monthly premium. In 2024, the standard premium is $174.70 per month. Higher-income individuals pay more through what's called IRMA, Income-Related Monthly Adjustment Amount. Part B also has an annual deductible of $240 in 2024. After you meet the deductible, Medicare covers 80% of approved costs, and you're responsible for the remaining 20%, with no out-of-pocket maximum unless you have supplemental coverage. Part C, also known as Medicare Advantage, is an alternative way to receive your Medicare benefits through a private insurance company approved by Medicare. Medicare Advantage plans must cover everything that original Medicare covers, Parts A and B, and most plans also include Part D prescription drug coverage. Many plans offer extra benefits like dental, vision, and hearing coverage that original Medicare doesn't cover. The trade-off? Most Advantage plans have network restrictions. You may need to use specific doctors and hospitals, so it's important to check if your doctors are in-network before enrolling. Part D covers prescription drugs. It's provided through private insurance companies approved by Medicare. The average monthly premium for Part D in 2024 is around $55, though it varies widely depending on the plan and the drugs you take. Each Part D plan has a formulary. That's the list of covered drugs. Make sure your medications are on the formulary before you choose a plan. One critical thing to know: if you don't enroll in Part D when you're first eligible and you don't have other creditable drug coverage, you may face a late enrollment penalty, and that penalty lasts for as long as you have Part D. So, when do you sign up for Medicare? Your initial enrollment period is a 7-month window. It starts 3 months before the month you turn 65, includes the month of your birthday, and ends 3 months after. If you miss this window, you can sign up during the general enrollment period from January 1st to March 31st each year, but you may pay late penalties. There's also a special enrollment period if you delayed Medicare because you had qualifying coverage through an employer. In that case, you have 8 months after that coverage ends to enroll without a penalty. Let's talk about what Medicare actually costs month to month. Most people pay $0 for Part A. Part B is $174.70 per month. Add a Part D drug plan at around $55 per month, and you're looking at roughly $225 to $250 per month just for basic Medicare coverage. Important: Original Medicare alone, Parts A and B, has no out-of-pocket maximum. That means if you have a serious illness, your costs could be very high. That's why many people add a Medigap supplemental policy or choose Medicare Advantage, which includes built-in cost limits. That's Medicare in 10 minutes. Part A, Part B, Part C, and Part D. Know your enrollment windows, understand your costs, and don't miss your deadlines. If this video helped you, please give it a thumbs up and subscribe to Medicare Clarity. We publish new videos every week to help you make sense of your Medicare options. Thanks for watching.